we know that COVID disproportionately affected those susceptible to poverty in those types of communities and racialized communities. I don't know if you guys got to see the new study that was released today by some researchers that sort of outlined some of the reasons for that and gave some recommendations to the government. I'm wondering what the plan is in the event of a second wave to prevent racialized communities, you know, the communities that have people who work the low-paying jobs and in healthcare, etc. What's the plan to prevent those communities from being so heavily affected by COVID again?
Okay. You want to answer that because you've already answered that, and if need be, I will complete the answer.
In fact, since the beginning, the vulnerable populations are being are part of our preoccupation, and as elsewhere in the world, everywhere, those densification populations where there is more people, less distancing possible, are important. Just as an example, we have done for the homeless people some strategies to make sure that if they get infected, they will be taken care well. So I think that from the recommendations from those studies, you cannot change suddenly, I would say, the environmental of those persons, but we can have a better communication with them, taking into account their needs, finding, I would say, some alternative solutions if they get infected and there is a problem at home and everything as it has been done. So I think, and it's very important, I think, for those communities to try to respect more, I would say, the recommendations. But that's not an easy question because we cannot correct that for a long term. But I think also with the programs that are going to be put in place to help the ones who need more is part of the solution. We are discussing that with other parts of the government, even about different subventions. We are working a lot with municipalities to make sure that we don't forget those communities which are at a higher risk. And each of the directors of public health knows their specific areas where some specific interventions could be done, more screening perhaps, to make sure that we take care of them and making sure they can get access to care.
And Mr. Dubé, I mean, it wasn't something that you mentioned as part of your 4 points today. You know, we heard a lot about we don't want what happened in the CHSL days to happen again. But, you know, what's your take on not making sure that this doesn't happen to our cultural communities again? Why didn't you mention it before?
Well, because to me that's an integral part of our strategy. You know, when we discuss the aspect of communication, especially in Montreal, we have discussed that with Health Montreal to make sure that we didn't forget any people. That's the point that was made. As an example, I think, I don't want to name a specific region, but I have one in mind where I think we were slow for making sure the testing was available. And then what we have reacted is now we make sure that in any of those regions on the island, we can go for the tests with appointment, without appointment. We have mobile, and this is what we're discussing with public health in Montreal, so on the testing. The second point is on communication. I don't know in how many languages we're translating right now all those guides that are being prepared, that are being finalized. I wouldn't count the number of languages, but it's more than 10. So I'm just saying, I think we're sensitive to that, and this is what we've learned from the first wave. So communication, testing, and making sure that national health with Dr. Arruda, but also local or regional health, such as Montreal, we are on the same page on that.
And I may add, just one thing I forgot to tell, is that we are also working with different organizations from the society civil to work in the field, in those communities, or by those communities, to make them implications. So there's going to be more projects in the community made with partners in the community to go, and because those people sometimes don't consult our healthcare system for different reasons. So this is part, I would say, of the solution, and we are working that with great people who have made nice interventions in the community.